Today on Dance Med Spotlight, I talk with Dr. Sammi Harmon, a physical therapist who is currently on the North American tour with Frozen the Musical. We get to talk about what it is like being a PT in that kind of role, what her schedule is like, what her dancers and performer schedules are like. We talk about some of the perhaps more unique things that get encountered working with shows like this versus even typical dancers that we may see or versus the general population. Lots of interesting things that we get to talk about with this unique type of setting, and also talking about some of the challenges that we encounter with working with dancers or performing artists as medical providers and working with folks who push their bodies beyond the normal limits like we learn in school. Lots of really great information. Be sure to check this one out. Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine and dance science. Today, I have with me Dr. Sammi Harmon, a physical therapist who has been on tour with Frozen the Musical, going through North America. Welcome, Sammi.
Yes, thanks so much for having me, Alyssa.
So, Sammi, my first question for everybody on here is, tell me a bit about your journey getting to the point knowing that you wanted to work with performers as a healthcare professional.
Well, I was actually a dancer, performer, still am, for pretty much my entire life. Grew up doing pretty much all styles of dance, but with a focus on ballet. I studied ballet in college at the University of Utah and danced professionally during and after that point. But I had, from a young age, always been interested in science and really considered a lot of different healthcare fields for a while. I thought I wanted to be a surgeon. But then it was my experience having low back pain as a dancer that led me to seek physical therapy for myself starting at about age 14. And my experience working with a PT really kind of opened my eyes like, wow, this is a really cool career. So I kind of decided to go that route really from an early age. I think even in high school, I had pretty much decided that eventually at some point I wanted to be a physical therapist. And the idea of getting to work with dancers and using all of the backgrounds and education and training that I'd been getting since the age of 3 really to apply that with the additional knowledge that a physical therapist has to help dancers, stay healthy, recover from injuries, all that. So, like I said, I danced professionally for a few years, but always with the idea at some point I'm going to go to PT school. So, about a year after college, I decided to apply to school and then went to the University of Colorado and graduated with my PT degree in 2017. I did continue dancing through PT school and afterwards, so which was really helpful for me in a lot of ways, just to stay connected with the community and also just help balance my life. When school was stressful, it was nice to always have dance to turn to, really just to kind of feel connected to my former identity as a dancer and also just
Mhm.
the physical exercise and just connecting with people that are really important to me, and still being a part of that community was huge, I think, in helping me get through PT school.
Yeah, and it's such an outlet for things. I know I stopped dancing after high school when I was an undergrad, kind of
Mhm.
thinking, that phase of my life is over. And I was still living at home when I was going to undergrad, and I started driving my parents crazy, like leaping down the hallway and pirouetting in the kitchen. And my mom finally
Mhm.
was like, Can you please go do something, like, take a class? I don't know, do
Yes,
something."
totally.
Um,
Yeah,
so
me and my
couldn't leave it
friends have
behind.
joked that, like, dancers are terrible at retiring, we'll say that, "Oh, we're done, this is it, this is my last performance," and then there's just always, I think, that internal drive that really wants you to keep moving and be part of something, so, it was
Mhm.
definitely a shift in mindset from, like, "I'm going to be a full-time professional dancer," to, like, "Well, I can still dance, and I can still even perform and be part of like professional works, but it doesn't have to be a full time thing."
Yeah. Yeah, definitely. So, you've been on tour, the North American tour with Frozen.
Mhm.
Tell us a little bit about what that means for people who aren't familiar with the
Yeah.
traveling PT style.
Yeah. So, I mean, I wasn't familiar with it really either before I started. But yeah, I am with the Frozen North American tour. So basically, if you've been in any major city and you have like a Broadway tour schedule and you've seen Frozen the musical come through, that's our show. So we tour throughout North America. We're in each city at least 2 weeks, sometimes longer. We usually have longer sit downs in some major cities, especially around like the holidays. And then just depending on the market and the demand for tickets, we might be in certain cities longer as well. But we're in each city for at least 2 weeks. We do typically 8 shows a week, the same as a Broadway schedule in New York. Um, so that means that all of our performers are all doing 8 shows per week because everyone is single casted. That means everyone does the show every time. Of course, there's understudies for everyone. All the principals have 2 understudies, and there's swings that can fill in for ensemble roles and other smaller roles. So, because certainly people are out for injuries, they're out for illnesses, and they get vacation days as well and sick days as well. So it's pretty rare that we actually have the full company in the show. There's usually at least 1 or 2 swings on stage, but yeah, it's a very physically demanding show. Really, when you think about the volume that they're doing,
Mhm.
and then the addition of yeah, after 2 weeks, we all have to pack up everything and move to a new city. Most of the time, that's flying, unless the cities are very close together. We'll take a chartered bus. Um, but yeah, then we're in a new city. We usually have a Monday travel day, and then we'll typically have Tuesday off to kind of get set up, get groceries, have to start all over with all of that, get settled in
Mhm.
whatever hotel or Airbnb we're staying at, and then start back with the show on Wednesday. So it's very busy. We don't typically have breaks. Even holidays, we either don't have a day off, or if we do have the day off, they'll add another show somewhere else. So it's
Mhm.
pretty much nonstop. Um, I would say physically, while the show may not be as intense as, say, like a dance company's performance, just the fact that they're doing it 8 times a week is a lot of physical stress. And just the fact that they have so many quick changes, like the ensemble is basically never resting the entire show because if they're not on stage, they're running backstage, getting into a different costume, changing their shoes, changing their wigs. So, um,
Mhm.
yeah, they're never resting basically from the moment the curtain goes up. Plus, the costumes are very heavy. It's frozen. It's supposed to be, cold in wintertime. So they're wearing like wool sweaters and leather pants, and the ball gowns are super, super heavy. So that can create some issues in and of itself, just the weight of the
Mhm.
costumes. A lot of the performers have told me, like, yeah, if we could just do this in like workout clothes, this show would be easy. But yeah, so it's a pretty crazy lifestyle. But it's a lot of fun. We get to see a lot of the country, explore new cities.
Mhm.
So it's definitely a unique travel role for a physical therapist, not like a typical travel PT job. But
Yeah.
it's been a really cool adventure and definitely a different setting. I'm working in a theater. I usually just have a small dressing room. I have a road box that has my PT table as well as all my equipment that I unload in each city. So everything has to be semi-packable and portable. That means I also have to like deflate my exercise ball every city, reinflate it like over and over again. So
Mhm.
it's a lot, but we make the best of what we have. So and we can get a lot done, really, even just in a small PT room. So that's pretty
Mhm.
cool.
Yeah. It's those little things too that I'm sure we all take for granted, like the deflating and reinflating the ball all the time every 2 weeks or something like that, um,
Mhm.
where, we just have to make sure it's pumped up, but that's about it.
Yeah, right, and even just, like, ordering equipment gets kind of tricky because it's like, I don't wanna order it at the end of a city because then Amazon, of course, will send it a day later, and then it gets lost somewhere, and either I have to forward it or we never find it, and I can't order, like, too much if I get, like, too many bottles of lotion or whatever, it's like I don't have room for it, so I have to be
Yeah.
careful about taking inventory of all my supplies and just making sure I'm stocked, but also not overflowing because we do have a limited amount of space.
Mhm. What sorts of things are you seeing as far as injuries and needs that the performers have that are maybe different than a typical patient that you would see in the clinic?
Yeah, it is quite different. Just of course, again, when I said the volume of shows they're doing, most of the injuries I see are overuse, just repetitive trauma type injuries. So that's the main thing I'm dealing with. The nice thing about this job is we're not going through insurance. I mean, the show just pays to have me there to see the performers as well as the crew and the musicians, basically for whatever they need. So the nice thing is I can do more maintenance work, things that is kind of a big no-no on the insurance side of
Mhm.
things. So people can come in and just say, my calves feel tight, and I can just do some soft tissue work on their calves. Um, or whatever they need. They don't necessarily have to have a specific injury going on in order to come see me, which is nice because a lot of times that could just be very preventative for injury. So before they
Mhm.
end up with an Achilles tendinopathy or spraining their ankle, we can, stay on top of things before they get to that point. And a lot of it too is looking at, choreographically or things they're having to do in the show to maybe modify things or just adjust their form again to prevent injuries because, someone kneeling down into like a deep squat, if they're not doing it with great knee alignment, they got some knee valgus or something going on, may not be bothering them right now, but again, 3 months from now when they've done the show 130 times,
Mhm.
um, they may have some knee pain. So if we can kind of look at those, and our stage managers are great about like, hey, would you take a look at so and so's knee or ankle or what they're doing at this part because it looks like a weird position to us. Can you maybe
Mm.
talk with them about that? So they're good about trying to stay on top of things as well. And
Mhm.
just talking to me when they're concerned about someone having maybe a potential injury. And then certainly we do get some acute injuries as well. So I'm there to help screen things, to help determine, do they need to go to the emergency room or do they need to see a physician? Do they need imaging? All that sort of triage that needs to take place. Concussions can certainly happen too. So
Mhm.
I'm there to screen for concussions and help manage those. So yeah, it is a little bit of everything. I'm also the only medical staff of any kind that travels with the show. So even people that have some other sort of medical issue, they'll at least generally tell them like, Sammy, come down or go up see Sammy and just determine, do they need to go to the hospital? Do they need X, Y, and Z? So
Mhm.
yeah, it can be a bit of everything, but overall, I'm mostly doing kind of management of chronic issues or maintenance work, helping prevent injuries due to the repetitive nature of their jobs. So it is a lot of manual therapy. That's like probably 90% of what I'm doing.
Mhm.
Yeah, tissue work, joint mobilizations, a lot of dry needling. Um, Cupping, any kind of modality like that. And then most of the exercise I do is corrective exercises to help, manage muscle imbalances, which is big because, again, just the repetitive nature of
Mhm.
doing roles that may not be supernatural. Like, for instance, the people that I see the most are Svens, the reindeer. That is the one role that and the kids in our cast that is double casted. So we have two because it's just such a physically demanding role that they
Mhm.
alternate. But they're basically on like a little modified crutch on their hand with their feet back on stilts, with about a 40-pound costume on top of them. So you can imagine that it's a ton of strain on their spinal extensors, their necks, their backs, and their shoulders.
Mhm.
So I see each of them 3 times a week during basically all of our first act, which is just over an hour. And we do a ton of dry needling, basically whatever they need, just to help basically maintain so that they can keep doing that job over and over again.
Yeah. That's something that I think sometimes can be easy to forget about is just the costuming, do they need to climb on part of the set? Do they need to, what are some of those other things that can
Mhm.
influence their movement or have them moving abnormally compared to what a normal human moves for?
Totally.
And it's not just dance choreography or something like that that is causing a problem.
Yeah, and I think that was a big thing for me to consider because typically dance costumes, they're pretty light, they're pretty stretchy. It's not usually a big hindrance or doesn't affect your movement too much because they're designed to complement the movement. Some of these costumes, I will be honest, definitely hinder their movement or make it harder. And I mean, certainly a puppet like that is just a lot of weight, a lot to manage. And sometimes they'll end up with like, I don't know why my neck's hurting on this side. And turns out maybe something's a
Mm.
little loose, that the actual puppet head is moving too much. So they're having to work harder to stabilize. We have a full time person in our wardrobe department who's just like our puppet master, and she maintains the puppets, repairs them, will look at things. She's great at problem solving. I honestly think her job is like the most similar to mine because she'll be like, huh, something feels weird in your head. Okay, let's take a look. Oh, this is a little loose. Let's tighten this up. So we have very similar jobs. She's just working on the external puppet and I'm working on the person inside. So two of us, work hard to keep our Svens in shape.
Yeah, sort of 2 parts of the same body there.
Yeah, exactly.
So what does it look like for you as far as, is it being on site before, during, and after a show? Do you have regular office hours between shows? What does that part of your work look like?
Yeah, my schedule's pretty much set. I'm there starting 2 hours before the show, and I have 30-minute appointment slots. And then I'm there through the show. So I'll also have a slot during Act One, during intermission, and during Act Two. So we use like just a Google Sheet so they can log in and just sign up for a slot whenever they need one. We basically say it's, limit to signing up to 3 slots a week just to give people a chance to sign up. But it's usually not an issue that we're running out. Occasionally it does happen where I'm just fully booked and there's not a lot available. But um, yeah, so then that gives people a chance to sign up if they're, yeah, feeling some soreness. And then certainly if there's anything emergent, I'll have a performer or a stage manager, just text me and say, hey, can you come look at this person? I also have a radio if there's an issue going on during the show that they'll radio me to come down to the stage if needed.
Mhm.
But yeah, otherwise it's just scheduled appointments during the show. Like I said, Act One, I'm usually seeing one of the Svens. Intermission, they can either sign up in advance or just walk in. And Act Two, same thing. Um, that is often when I'm not as busy because most people are on stage during Act Two or working backstage. But certainly I can see some of the swings if they're not performing that show, or sometimes like our conductor will have a show off or whatever and will come see me.
Yeah.
And occasionally I will stay after the show. Sometimes maybe just a dry needle, like someone might have a really tight calf and they come in for ankle pain and like, I'd love to needle this, but I don't want to do it right before they're going to go on stage. They'll say, just come back right after the show and we'll just quickly needle your calf. So
Mhm.
it has the evening to recover. So pretty much set hours most of the time. Occasionally, a company management will ask me to come in and see maybe a crew member as they're loading into the theater, because that is an extremely physically demanding job, loading in all of the sets, costumes, everything that is required for that show. It moves on about
Yeah.
20 trucks. It's a huge show. So yeah, they're very, very busy. Yeah, occasionally I'll come in for extra things like that. But for the most
Mhm.
part, yeah, just to sign up slots before the show, working through the show. And then when the show's over, I'm free to go home.
Mhm. That sequencing is also a really important thing to think about when you were talking about, I want to needle this calf, but right now is
Mhm.
not the appropriate time. I think sometimes if people aren't used to working with athletes or performers on site like that in the
Yep.
middle of all the stuff, that can be an easy part to forget,
Yes,
knowing, this might make them sore. It might be, cupping might leave marks on them, but that area is open from their costume and we don't wanna see the giant bruises from it, or who
yes.
knows what can be impacted with treatments that we do on site.
Totally. And yeah, because it is right before they're going to be performing. Yeah, it's definitely a different mindset than seeing someone in a clinic, on their day off, in terms of what you can do and how you treat them. So yeah, I do have to be mindful to not, go too crazy with needles, especially if someone's going to be on stage. And taping as well, it has to be, I mean, we're lucky in this show because they do have a lot of costumes. Most of them are pretty much covered. I don't have to worry about it too much, but there are certain things where their knees or arms are exposed. So I have to use, skin tone tape. And also just be mindful that I'm not overdoing it so that they can still move the way they need to. So, typical athletic ankle taping is usually too much for a dancer. They just won't tolerate it because it
Yeah.
limits the range of motion too much. So I might have to modify it, or, do a similar taping that you might do with athletic tape, just with KT tape, so that they can still move the way that they need to while still getting a little bit of support.
Mhm.
The other issue with taping is because, especially our ensemble members, they have so many costume changes and
Mm.
they get so sweaty that a lot of times it just won't stay on, and they'll tell me like, "Yeah, that tape really felt great for the first 5 minutes, and then it fell off." So, um, I do keep, adhesive spray to help, but for some of them that are just really sweaty, it just does not work, so we just have to figure out what else we can do.
Mhm. Talk to me about how you manage thinking of someone who is, like, maybe they're in the middle of performance and something is bugging them and they come to see you. Kind of that difference of getting you through the rest of the show versus actually taking care of the problem, like we might in the clinic.
Yes, totally. Because it sometimes, it's during the show that they'll say like, "Oh, my knee really hurts," and I will have 5 minutes to assess before like I have to go back on stage. So the first thing we really have to determine is, yeah, you got to move quick, but we have to determine, can they go back on stage, or is it safe for them? Is it a matter of like, yes, you can go back, it's just going to hurt a little bit, or like, no, this is actually dangerous. We need you to stay off stage. So that's the first thing we have to figure out. So just being super quick with things like, doing a quick McMurray's or a Lockman's or whatever. Like, do they have an actual serious injury going on, or is it just something, more muscular or not as concerning. And also considering they may be in full costume, they may not be able to lie down. We might have to modify it, just sitting in a chair or whatever, because they may not have time to come up to my room. So have to be super
Mhm.
quick and creative in terms of how we assess those things in less than ideal conditions. Also, usually backstage where there's minimal light. So I may not be able to see their knee or whatever it is very, very well. But yeah, determining, okay, are they safe? Yes or no? Obviously, making sure that they can weight bear appropriately through that limb. Are we already feeling any swelling? Those would be obviously things that would take them out of the show right then. Um, and also what's coming up in the show. Do they have a huge dance routine that they have to do for 5 minutes straight, or are they just gonna walk on and sing and then they're able to come back off? So quickly determining those and knowing the show obviously is what really helps with that, and why
Mhm.
it's a benefit that they have someone touring who does know the show versus just bringing someone into each city who wouldn't know those things. And then from there, looking at, generally the next thing I'll do is look at the muscles surrounding whatever joint or area is the problem. Um, Again, with this population, that's most likely the issue is a muscular
Mhm.
issue, unless it was a more serious injury. So a lot of times I will just, try to maximize the time I have. Like, yeah, let's release your gastroc, your quad, or whatever. Let's mobilize your patella, or whatever I can do in a quick amount of time to just get
Mhm.
them moving better. I also usually will keep like some K tape with me too, just to help give them some tape really quick to get them back on stage. And then it's reminding them that they should actually come back and see me for a full session because that's probably not going to take care of the problem. Um, and even if it's something that they're like, "Oh, it's feeling a lot better than it was," it's like, "Yeah, but still come see me because it may still be something that persists, or we don't want it to get worse or come back again. So let's actually fully assess it,
Mhm.
figure out what caused it, and give you an actual treatment and rehab plan versus just a very quick hold you together."
Yeah. And I think something that you said there is an important one, thinking about knowing the show. It's
Hmm.
not just knowing the costumes and things that they have to deal with, knowing the choreography that they have coming ahead of them, thinking, like for some of my dancers, it's Nutcracker season approaching. And
Hmm.
are they in snow and they have a problem coming up because that's going to be a long time to be on stage to have to work through versus something where they're sort of popping in and off for a while and being able to use that as a guide for how we're treating. And yeah, that's definitely a thing too, where it's helpful to
Hmm.
have that person who's familiar.
Yeah, and that way we can also have conversations with our dance captains or stage managers about like, hey, is it possible that they switch the leg that they're kneeling on during this part, so that they're not, yeah, again, re-irritating an already injured joint. So things like that can be super helpful just to manage so that we're not necessarily taking them out of the show, but can allow them to continue performing without just re-irritating things. Um, and yeah, just knowing what they're going through every every day is really
Yeah.
important. And I mean, I honestly don't get to watch the show that much because I am working back in my room during it. But yeah, if I have an act off, I'll try and go backstage and watch. Or if they have what we call put in rehearsal, where they're putting a new person into the show and they'll do the show, I'll, sometimes just go in the audience to watch that. Just to again see it from the front, take a look at if I'm seeing anything, just alignment or technique wise that looks off to me. And yeah, it's just a good reminder of what they're putting their bodies through. Because sometimes, yeah, working with the Svens, I'm like, gosh, I'm just doing the same thing every day. I'm like, am I helping them at all? And then I remember, like, oh yeah, that's what they're doing. So the
Mhm.
fact that their shoulders are still tight doesn't mean I'm not helping, but yeah, they're just constantly putting that stress on their bodies. So
Mhm.
just having a good understanding of what that actually looks like is super important. And the performers really appreciate it too. And I've had some of them say to me like, "Wow, it's really nice to know like you're a performer, like that you know what it's like." Because I think that's definitely lacking from a lot of healthcare professionals working with performing artists that they just don't quite understand. And that's often a struggle with some of the physicians that will see our performers, especially on the road in some small town in Ohio or whatever, that they're like,
Mhm.
"Yeah, you can continue to perform as tolerated," and I think they think they're literally just walking on stage and singing and walking off, and that's definitely not the case.
Mhm. Yeah, it's so important to understand all the things that come with being a performer. The culture, the language, the expectations, the stress and methods of stress release, the
Yeah.
schedule, there's so many different elements, the opportunity of what you can eat and when. I was
Mhm.
having a conversation with another physio who works with performers and was saying, even knowing when you're done with a show, is there a place where you can go get food if you want it? Or do you have
Yeah.
to prepare ahead of time to have done some grocery shopping and have something at the hotel that you're staying at?
Yeah, and that could be a huge struggle for tour because, yeah, some of these cities, like, everything's closed at 10, there might be a pub open, but like, "Oh, our kitchen closes at 10." So, you're just out of luck for finding food after a show sometimes, which can be really difficult. Or, the only thing available is, like, french fries, just, like, fried food, that can be challenging to have healthy options. So, luckily, I think the actors are really supportive of, when they have new people coming in, of just kinda helping them manage all of those life things and getting them
Mhm,
used to that and just sharing with them their meals or eating schedules, that what's worked for them. So that community, I think, is pretty good about that. But yes, definitely a lot of extra challenges that you wouldn't really think about.
mhm. Are there any challenges or things that you've noticed for yourself as the PT on tour with them where it's like things of how your body's feeling or things that you're needing to do differently for self-care versus when you were working in a more typical place for PT?
Yeah, totally. I mean, I definitely have some of those same problems of, yeah, getting out of a show and I'm hungry and oh, nothing's open. So, um,
Mhm,
it is hard, especially because, my hours are typically around 5:30 to 9:45 p.m. So, still that question of when do I eat dinner, So, I've kind of had to figure out and modify my schedule where I eat like a late breakfast and then maybe a like lunch slash dinner and then some sort of snack or meal after the show. But that's always kind of tricky to figure out. And then, yeah, because I'm just working with a portable, plinth, I don't have a high low table, which sometimes is definitely more stressful for me. Just that,
mhm,
yeah, the table is often not the height that I would like it to do a specific technique or to work on a certain body. So that definitely does place some extra stress on my body. I will feel it in my back. And then, of course, I am then the only person on the show who does not have access to physical therapy myself. So, I mean, I have dry needled my own forearms just sitting in the clinic because I'm like, well,
mhm,
there's no one else to do it. So, um, certainly I obviously have the access to my knowledge and the education to know like what to do for things. But in terms of manual therapy for myself, it's just self treatment. And I will often just find like a massage on the road.
mhm,
Our performers are great at finding massage therapists. They're like, oh, I found someone really good. And so I will do that too, just for some maintenance for myself.
mhm,
Um, but yeah, it definitely comes with its extra challenges. Plus, just having a travel day every 2 weeks, being on a plane. Another thing I've encountered is, not all hotels or Airbnbs have the best mattresses and pillows. So that could be an issue for myself and for our performers.
mhm,
So yeah, there's a lot to manage. But I think just trying to keep a consistent schedule as much as possible helps. I would say another challenge too is just exercise. Like I love doing classes, whether that's dance classes or a Pilates class or yoga class, and just our access to those things varies greatly in each city. So I do try to be somewhat proactive and look up places online before I get to a city, but yeah, just transportation of getting there, and will they have classes that will match our schedule is all kind of up in the air. So that's
Mhm.
definitely been challenging as well, just to, keep my own health in mind with our crazy schedule.
Mhm. I know one thing I've encountered too when I have been able to be backstage in a theater setting like that was sometimes the spaces that we had to set up in. I remember one theater I was in, it was this tiny dressing room down this awkward set of stairs. I don't even think there was another way to get to it but these stairs, and
Mhm.
luckily, they had a table that they brought along with them, so I didn't have to haul a table up and down, but it's like, "How the heck did you even get this in here in the first
Yeah,
place?"
yeah.
Or some of them are just cramped spaces where it's like, "Okay,
Mhm.
I can stack things a certain way, and how do I get to stuff?" And the spaces to work in are not always ideal.
Yeah, totally. Yeah, and that varies again a lot, theater to theater in whatever city we're in. Because yeah, I've definitely had a couple dressing rooms where the table sticks out the door, so I can't shut the door. There's just that's the only way it will even fit. And sometimes I won't have room to, walk all the way around or to stand on one side of the table. So it's like,
Mhm.
I have to work from there, and then I'm having to have them flip over and then turn their head this way, turn back this way when they're flipping from supine to prone. So those things can get tricky, or where, in order to have good body mechanics, I would want to be in a nice lunge and leaning over, but there's just not enough room to do that. So that can definitely make things tricky as well. And usually 95% of the time, they will move my road box with all my equipment into my room. Sometimes either the road box won't fit, or I've had times where there's, yeah, no elevator. So I have had to carry up everything, carry the table up, carry all the weights up, all the bands, all my equipment up into the room. And so when that happens in those cities, it's not the most fun. And then it is kind of also ironic to have the PT room, up a flight of stairs. So if someone is like, "Oh no, I hurt my ankle." Like, you have to get up this flight
Right.
of stairs now just to see the PT. So yeah, definitely not always ideal spaces. And some rooms I'll have like a great space, and I'll have room to set up a yoga mat and a little exercise station. And then I've had rooms where the ceilings are so low that some of our taller people can't even reach their arm overhead to, do an exercise because the ceiling is so low. So yeah, you just kind of have to learn to roll with it and be really flexible and work with what you have, and know that things are not always going to be ideal. But I guess the good thing about that is, it's only going to be 2 or 3 weeks, and then we will move to
Mhm.
a different space. So just have to kind of exhale and work through it, and know it's not forever.
Mhm.
And it makes it hard when we do have those really great theaters where everything's super nice and clean and spacious, that like, "Oh, now the next place is not gonna be this nice."
Mhm. Talk to me about sort of how you've learned to work with the performers. Is it a lot of pulling from your own knowledge as a performer and as a dancer? Con ed courses that you found, getting to network with other professionals? Like what have been some of your primary sources for even learning how to help these folks like this?
Yeah, I mean, definitely pulling from my own knowledge as a performer, as a dancer has been huge. And that just allows me to speak the same language as them in terms of, choreographic steps or things like that. And just knowing all like upstage, downstage, stage right, stage left, those things. Um, Knowing the schedule, knowing what a rehearsal means, that sort of thing. I just had the benefit of having all that knowledge and training before I ever became a PT. And then I did shadow some PTs working with dancers a little bit before school. I started shadowing a PT at Colorado Ballet, which worked out well because then I did work with them professionally after PT school for a while as well.
Mhm.
And then I also had a great clinical instructor during my second clinical education during school. She ran like the dance clinic at the University of Utah. So I learned a lot of specific, dance treatments from her, assessments that she used, just taping techniques, which was super valuable. And I just got to see a lot of dancers, a lot more than I obviously would in any just general clinical education.
Yeah.
And certainly, that's not stuff that we're really learning in just a general DPT program. You learn some sports things, and some of that applies, and a lot of it doesn't. Um, of course, we learn a little bit about like hypermobility conditions, and a lot of that does apply to this
Mhm.
population. I've been a member of IADAMS for about 6 years. I've been to their conference before, and some of those courses or lectures I attended, I still use a lot of the exercises or assessment techniques that they presented. Um, and then I also learned going into this role some vocal techniques, some vocal massage, which was something that was pretty new to me.
Mhm.
Which is, basically just massage techniques, really focusing on like the superhyoid muscles, infrahyoid, of assessing hyoid mobility, as well as just jaw release, whether it's dry needling, soft tissue, some like active release techniques, that sort of thing. And that's oftentimes super tight and they're just not aware of it, but they might not even realize, like, my neck feels tight, or I just feel like I'm having to work harder, to sing, or I'm like having difficulty, getting all the way up through my range, blah, 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 blah. And a
Mhm.
lot of times we'll just get in there like, oh, yeah, this is super tight. And they're like, whoa, I had no idea. Um, and so, yeah, learning more vocal techniques and just learning more about being a singer and what that looks like has been newer for me. But yeah, I've
Mhm.
definitely gained a lot of knowledge as far as that goes. And Yeah, I think the performers just really appreciate that extra knowledge because that's something that you don't typically get in a PT visit with someone without experience in the performing arts.
Mhm. For sure. Going back to something that you said, thinking about, um, being able to, pull from your own experience and layer that on top of what you learn in PT school. There's so much that I think the people who don't work with performers or even performers themselves don't necessarily realize how much more we push our bodies
Mhm.
than other folks. Like, for example, looking at research, I think there was a study that looked at professional ballet dancers and they looked at plantar flexion, how far the ankle can move downward. And
Mhm.
the average professional ballet dancer that they measured, it was like 114 degrees of plantar flexion. But you look in any medical textbook, and an average is probably around like 45, 50. And
Mhm.
when I tell some of my dancers that, they go, that's all that a regular person is
Yeah.
expected to move. So in PT school, we're taught to get people to that normal,
Mhm.
but our performers need to be able to do so much more than that. And
Yes.
figuring out how to help get them there, how to safely get there is so
Mhm.
important.
Yeah, and I think, like, hamstring length is another, like, easy example of that too. Like, learn like, oh, 90 degrees is great for a straight leg raise, but for them, like, that's like, that's all I can get. I feel so tight. And,
Mhm.
any just general practitioners can be like, oh, you're fine. You have plenty of flexibility, but that's not what their job demands. That's like telling a pitcher that like 90 degrees of external rotation is fine for their
Mhm.
shoulder when they need a lot more than that to do their job. And that was something I would struggle with a few times just in my previous job working in an outpatient orthopedic clinic when, we were using insurance and they would look at, my progress note and say, oh, well, they're fine. They have plenty of range of motion. It's like, but no, she does not have enough ankle range of motion to dance on point and be able to perform. So convincing them of that can be a little
Mhm.
bit tricky when their averages are normal or maybe even above normal, um, because that's just the demands of this job are not normal.
Mhm.
So yeah, you really have to appreciate that. And how, yeah, I think the dancers may not realize, yeah, just how exceptional that they are. And they might, sometimes I'll do certain tests and they're like, wow, I'm so weak. And I'm like, no, but I'm just being really picky to figure out like what can be improved upon because they may be super strong in certain areas, but then, when we're really challenging, their deep hip external rotators, um, and making them isolate that their form suddenly falls apart and then they just don't realize that that's an area of weakness that they have. And it's like, no, this is good because this is going to help your knee pain or hip pain.
Mhm.
As long as you just train these consistently.
Mhm.
I do think another big challenge though is also like adding exercise just because their schedules are so physically demanding with 8 shows a week, sometimes extra rehearsals on top of that, and a lot of them do go to the gym or take classes or whatever, but so yeah, just adding another thing for them to have to do is, not something I try to load up on a ton of, and, we obviously don't wanna get them into another kind of overuse by just adding too much exercise, so I think just being really mindful again of what their demands in the show are and really trying to make exercise plans that are pretty concise or if we have one exercise that can address 3 deficits, like that's ideal so that they're not having to add just a ton of extra things onto their day.
Mhm.
They very much appreciate that. Or just, having to sell it to them like, "Yes, I know this is gonna take an extra 20 minutes, but in order to protect your shoulder or protect your knee or to keep this from being a problem for the next year and a half that you're on this tour, like, you just gotta prioritize it." And most of them do, you know?
Mhm.
That's their livelihood, they wanna get better, they wanna stay on stage, so they're usually a pretty compliant group, which is nice for me as a
Mhm.
practitioner to have people that actually do what I ask of them.
Yeah, for sure. One thing I think also is interesting to think about that a lot of folks might not realize that we don't have a lot of great tests when we're looking at some of our performers when, sometimes you go to a physical therapist office, for example, we'll stay in the track of PT since we're both PTs, and you get an outcome measure, the questionnaire to fill out
Mhm,
and say,
mhm,
this I can run, I can walk, I can do whatever.
mhm.
There isn't a lot like that
Yeah,
available for our dancers, even thinking of ways that we test strength. Like, I was
totally.
I was working on a case report with one of my dancers, one of my teen competitive dancers earlier this year, and there were a lot of things that she technically was testing as a 5 out of 5 on a manual muscle test looking at
Mhm,
strength, but she still wasn't able to do things that she needed to do. So now
mhm,
I've been looking a lot more into things like hand dynamometry, where we can get a different kind of measurement to start assessing some of these things, because technically they're maxing out a lot of the things that we may normally go to as a
mhm.
physical therapist or whatever kind of provider that we are.
Totally. And I'll be honest, like in this role, I don't do many outcome measures just because, again,
Mhm.
insurance isn't barking down my neck. Like, are they getting better? Or,
Yeah.
but yeah, definitely when I was in an outpatient clinic, like the lower extremity functional scale, like a lot of these people are going to get 78 out of 80 because they can still walk up and down stairs and walk a mile without difficulty. And it's maybe just hopping that they circle a little bit of difficulty and they lose 1 point, So it's
Mhm.
not, yeah, it's definitely has a ceiling effect there. So I do tend to rely more on like functional testing of here's this movement they can only do 5 reps before failure or things like that, or things like the
Mhm.
heel raise test for gastroc strength rather than just an MMT because, yeah, they're all gonna be 5 out of 5. So, we need something else that can actually, um, demonstrate that. So, and yeah, other, more, standardized tests too, like, the lower extremity scoring system, I think that's
Mhm. Yeah,
less.
the less.
Yeah, like
Mhm.
those can be good. Things that, yeah, are looking more at function that are a bit more challenging can be really helpful. Or even, yeah, just documenting like how qualifying how their movement looks with whatever jump or movement is causing problems for them. And
Mhm.
just, yeah, being really careful about documenting that and using that to track progress can be really helpful because, yeah, a lot of those standardized tests just aren't super useful for this population.
Mhm. Let's go back to talking a little bit about your experience as a dancer and performer before even because you still dance.
Mhm.
Um, Tell me about some interactions that you maybe had with healthcare providers, whether they were positive ones or not so positive ones, and sort of how that impacted how, your dance and career with it.
Yeah, totally. I mean, yeah, when I first started having low back pain, like I saw a physician, I saw a chiropractor, um, and I mean, ultimately, they I didn't necessarily have a negative experience, but it wasn't really getting me anywhere.
Mhm,
And it wasn't until I started seeing a PT that I was like, "Oh, I'm actually starting to feel better," and that, ultimately that they gave me an exercise program which fixed the underlying problem was just that my core was weak. It was too weak for what I was doing. I started doing Horton, which is very demanding on your hamstrings and spinal extensors, and I just think I didn't have the core strength to support myself. So that was ultimately what got me back to 100%. Um,
mhm,
so that I think was huge. And back then, I wasn't seeing a PT who specialized in dance medicine or had really much experience with it, but still, what attracted me to the career was just how much time they actually get to spend with their patients. That, I would see them for 30 minutes once a week or twice a week or however often it was, but that they actually took
mhm,
the time to get to know me, or I could tell that, they would look things up to try to figure out, like, okay, this didn't really work last time. So I looked this up. I think this might help you.
mhm.
So I really appreciated the amount of interaction with you get. And as a practitioner now, I really appreciate that. But then, yeah, I'd seen like podiatrists for my foot before that have been like, have you considered taking up swimming? No, nope, I wanna dance, so
Mhm.
that's why I'm here. Because I know if I stopped dancing that my foot pain would probably go away, but I'm here because I wanna keep dancing without foot pain,
Yeah.
so, that can be a big challenge, and I've even with, yeah, some of our performers and principal roles in the show, I've seen doctors are like, "Hmm, you might just need to look at doing something else," and it's like, this is their career. This isn't some hobby for them, this is
Mhm.
their livelihood. And it just is so frustrating for them. It's frustrating for me when, they're putting this trust in a doctor or a provider who just basically blows them off or
Mhm.
doesn't take them seriously or, yeah, just tells them to get a new job. Yeah, I had
Yeah.
one patient, he was just like, "What, are you just gonna stop being a surgeon because, like, your hand is sore?" Like, that's not an option, so,
Mhm.
um, yeah, I've heard a lot of stories from a lot of performers, both that I've worked with as patients and as friends, that have had experiences like that. And, I guess my initial response is just, yeah, get another opinion. You don't need to work with someone who isn't willing to listen to you. Um,
Mhm.
if you're able to find a dance medicine specialist, that's probably ideal, but at least just, look for someone else who's willing to hear you, do the research that they need to do to understand what's going on. Because, yeah, it can be super, super frustrating when someone just doesn't get it, doesn't get what you're putting your body through, what your goals are.
Mhm. And it's unfortunate when people have too many of those types of experiences and not enough of the positive experiences with providers,
Mhm.
because then that's when the performers way often turn to, "I'm just not gonna go see anybody about
Yes.
this," or,
Yes.
it sets up a bad pattern, um,
Yeah.
because
Or
they
I
didn't
may
have
just
good
have people
interactions.
too that come in and they're like, just automatically don't trust me, as a healthcare
Mhm,
provider because they have had such negative experiences, or just come in with the expectation that this probably isn't going to help. This isn't going to do anything for me, which we know from research, coming in with the expectation of success or not has a big effect on your outcomes, and if you
Most
do
definitely.
get better or not. So that can be challenging. But yeah, I just think really taking the time to, yeah, get to know your patient, get an idea of what their goals are, and just building that trust and rapport goes so far.
Mhm. At this point, I think this is a good chance to introduce a special segment that I always have on every episode. So, this is the final bow. Basically, what is your take home message for the audience? We've had a chance to talk about a lot of different things through our time together. So, what do you hope is like the one nugget that they take away?
Yeah, I think, as a provider or anyone who's working with a dancer, maybe even as a teacher too, just understanding what your performer is going through. Again, not just in terms of their physical injury, but how that affects them mentally in terms of their identity, their livelihood. Is that limiting their ability to work? And the stress that goes along with having an injury. That's stressful for anyone that
Mhm.
has, a sprained ankle or a sore neck or whatever. um, it's stressful, it's not fun, but when your job demands so much of you physically, and that injury really has such a limiting effect on your ability to perform your job, the amount of stress that puts on you is really hard to quantify or describe. And especially in
Mhm.
an industry like performing arts, which is so competitive, it's very easy to get in the mindset of like, well, I'm going to lose my job. That's it. So just understanding um, those layers that are on top of just the physical part of the injury is really important as a provider to keep in mind. And just knowing, yeah, again, the schedule that, like, especially for these Broadway performers, that they're doing 8 shows a week every single week without breaks. Um, it's really hard to understand because I've even seen some like dancer friends who've seen the show and says like, choreography doesn't seem so hard. Like, do they really need PT like twice a week? And I'm like, yeah, but think about doing that 6 days a week, 8 shows. We only get
Mhm.
1 day off per week, so, it's a lot. So I think just really being mindful of the performers and what they're going through mentally and physically is super important. So even if you don't know, the technical aspects of dance or singing or whatever it is, just being able to relate to them on that level, and considering the demands on them goes such a long way. And again, building rapport, building trust, and helping build a rehab plan or plan to get them better.
Mhm. Last thing, your opportunity for any shameless plugs. So, whether that's something that you have going on yourself, promoting the show that you're working with, whatever you want to promo, this is your opportunity.
Oof. I do have my own LLC back in Colorado. It's not really active right now since I'm on the road, but it's called the Dancing Doctor LLC. And that's something that I'll probably get back to whenever I am done performing. But I do have a website for that. And then you can find me on Instagram, Sammy J Harmon. It's SammiJharmon. And I just post lots of fun travel photos, basically, of all the places that the show is going to. Occasionally, a few behind the scenes snippets as well. So if you're really into musical theater or Disney, Frozen, then you can definitely follow me there.
Yeah, I've definitely been having fun checking out all of the pictures that you share on there. So, go check it out. Well,
Yeah.
Sammy, thank you so much for your time today. It was great having a chance to chat with you and learn more about what it is you've been doing on tour with Frozen.
Yeah, thank you, Alyssa. It's great to talk to you.
Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.